Welcome to the Aesthetics Injector Gang podcast. Having a gang of mentors in this industry has been a blessing that we wanted to share with you. Our core group has been traveling together and comparing notes about life and business for years. Tune in as we delve into topics with others in the industry that you are sure to love and make you laugh.
All right. Welcome to the Aesthetic Injector gang podcast. I have here with me Alfredo. He is in Ultrasound, and he and I just met very recently when I had a course with him after purchasing the MindRay device. And we kind of did a one-on-one training course with Ultrasound, particularly within the aesthetic space. And so I'm going to go ahead and put it over to you, Alfredo. Go ahead and introduce yourself to everybody.
Well, hello guys, nice meeting you. My name is Alfredo, and the last name, if you can pronounce it, is Ferreira. I'm an ultrasound practitioner, and my specialty is in musculoskeletal and facial ultrasound.
So you specialize in that. Can you tell us a little bit about how you got into specializing in ultrasound?
So I started at a very young age. Ultrasound, I started when I was actually, wow, 1998, 97. I went to school right after high school, and I've been doing ultrasound since then. I was working at Cleveland Clinic in Western Florida for almost 15 years. Then I got the opportunity to go into Australia. So I moved to Australia to Queensland, and to be exact, I was in Sunshine Coast, and then I moved into the Gold Coast, in Queensland, Australia. And I was given the opportunity to learn everything about MSK, which is musculoskeletal ultrasound, dealing a lot with joints and tendons and ligaments that usually a regular sonographer is not really exposed to those things. Usually a sonographer here, we do abdominal, we do OBGYN, we do breast, small parts, and so forth. So it was a really great opportunity for me to get exposed. And when I came back from Australia back in 2017, I started to slowly by getting into facial ultrasound. And now it's being just, by trade, that's what I do now, and mixed with MSK.
So why do you think it's growing so much in the aesthetic space? Because I know I've been injecting gosh, for a long time. I first started my journey, I think back in 2014 is when I first started taking my courses. And it was not really a thing, and all of a sudden, I feel like it blew up during COVID. And I feel like we saw an uptick in people utilizing ultrasound in aesthetics. Why do you think that is?
Well, I think as the industry is growing, there's a lot of now. Obviously, there's PAs, there's NPs, there's even doctors crossing over from their specialty that they started with. Now they're crossing to aesthetics because it is a great field to get into it. It is fascinating, what you can do with you know, with everybody, be able to, fix their, scars and the wrinkles, and give them a little more volume if they lost some of the fat pad, and through the years. So it is a very fascinating industry. But what happened is, like, with all these people, you know, trying to do aesthetics, also becomes, unfortunately, there's going to be some events in which can put the patient at risk of, the major thing is basically for vascular compression, compromised vessels in the face. And injectors that have been doing it for a long time, they have a very good sense of the anatomy on the face, but new injectors that they have not been exposed too much to the aesthetic industry, and they're just starting, and they're doing all these procedures, then there's always a higher risk of causing some of these vascular adverse reactions in the face. But not only that, though, but now lately, uh, I've been plenty. I've done plenty of treatments that I got involved with, and the people come in and they want to dissolve the face. They want to dissolve the filler that they don't like it. It was done, like, 4 months ago, or a while ago. They just don't like it. They want to dissolve it. So instead of going blindly and trying to dissolve the area by guessing, now you have it's a tool that you can actually use now for identifying the filler, and then go ahead and under ultrasound guidance, you can identify it, hit it with the needle live, dissolve it. Patient gets poked much less times, and the hyaluronic is a lot less. You can do the face. That's one scenario. The other scenario is, like I said, for vascular occlusions. If God forbid, it happens to the best. If you happen to have a vascular occlusion, people freak out. They start injecting all the area. They start flooding the whole area with Hylenex, which is, that's what, is being done for a long time. But now with the ultrasound, you can actually, again, visualize where the occlusion is. Look at for the artery that is being involved in this situation, and then go ahead and take care of it. The other thing now is also with threads. You can people are doing threads, and it is great, but there's also some risk of puncturing a vessel, or maybe putting it too superficially, or too deep. So this will give you the access to visualize live where the cannula is, and then when you are ready to deploy the cannula, then you know where you're at.
It's interesting because I haven't done it with the threads yet. We just had our training together not that long ago, and I'm still playing with it. I feel like it's a technology that there's no way that you can just have it in one training. I feel like you need to do the training and then start practicing with it. But I find the most interesting part about it is the fact that I thought I was only getting it for vascular occlusions. If you had vascular occlusion, you could map it, you can look at the blood flow and be able to utilize less Hylenex, like you said. But then you showed me a cool little technique, something that you're working on, and I think you're currently working on getting it published, where you can actually ultrasound and see the filler and be able to differentiate the difference between filler versus a lymph node versus other types of conditions. Can you talk a little bit about that?
Yeah, so actually, that was I was scanning a patient's face a while ago, and the patient started to cough. And as she was coughing, I noticed that the filler was not filling in within. Well, I was putting power Doppler. So power Doppler is a way to
Sorry, that's
identify.
my dog. Gotta love podcasts with my buddy. You can continue on. Don't mind him.
Okay. So power Doppler it's a feature that you can use to obviously to identify filler. I'm sorry, to identify the vessels, but it's really sensitive. So back in the hospital, there's something called a Fremeris technique, and Fremeris technique is used in the hospital when you're doing breast ultrasound, and you can identify the mass within the breast tissue by having the patient hum. And because it is not nature of the breast or having that mass. So
Mhm.
again, so the wavelength and the frequencies of a vocal cords when you're humming is different from anything that is not foreign, that is foreign to the body. So when I was scanning this patient, that happens. I'm like, wow, that's kind of interesting. So I started playing with it, and I came to find out that it is a great, great tool to identify filler. And usually anywhere from 0 to maybe like to 4 months. Um, it- you know, it is a great tool. As filler gets older and it starts to dissipate into the tissues, then it obviously will be hard to identify it. Unless if there's something like a long term filler like Voluma or Bellafill, that it will stay there for longer. Uh, but yeah, so now the technique is called FIT. It's called Ferrera or facial filler identification technique, and I'm working with Dr. Kalenda in Canada, and he's been in the process of publishing already. So we did a bunch of testing, and I think it's great. It's not 100% bulletproof, but with the right settings at the machine, and it is really good tool to, especially if you have that question, is it filler or is not filler? So you can actually really identify by doing this the fit technique.
I'm laughing as I feel like your story with this, that somebody was coughing and that's how you saw it, is literally the story of aesthetic medicine. I feel like everything we do in aesthetic medicine is, oh, this is a good aftermath, right? For example, you look at things like Latisse and they're like, oh, it wasn't meant for that, but we're gonna have long lashes. Or Botox, it was meant for something else. And it's like, oh, it got rid of wrinkles. You're coughing and you're like, oh, look it, now I see I can tell filler. Like that's our entire industry because it's such a new industry and it's growing so much that a lot of these are found by little things like that. That's pretty cool.
Yeah,
And it works. I tried it. I tried the humming and it worked. So I can
you can
attest to
touch
it.
right.
Yeah, I can. I just thought it was hilarious because I just feel like that's everything in the aesthetic space. So, now is that something that you can be done on any ultrasound? Because the ultrasound I have is what's it, the Mind Ray? Did I
You
pronounce
have
it
the
correct?
Minor T5, yeah. Yeah,
Oh,
it can be done in a machine that it is obviously has a good power Doppler features.
mhm.
Unfortunately, with those handheld devices, I'm not sure how good could it be, but it's all about putting the presets, put the right again the right presets on the device. But it will be just a matter of trying it.
So, can you talk a little bit about the different types of devices? So, let's say somebody's listening and they're interested in getting an ultrasound for their practice or they want to start using it. Can you talk a little bit about the different ones that are available and any pros and cons of a handheld versus not and go along that?
Yeah, so I mean, again, I've been doing ultrasound for 25 years, so I've seen big giant consoles like they're cost like over $200,000, all the way to the small ones. So, um, and so I'm able to see what's good and what's not.
Mm-hmm.
Uh, so with that being said, I have tried when I work uh, with Joel. Um, we have tested it many machines in the industry, and we used to use a device called Konica Minolta. It's an ultrasound machine. It's great, but then we came across the Mind Ray. We started testing it out. We tested the Clarios. We tested the Butterfly. We tested the GE Venue. Um, so for the price and for the amount of high resolution that a machine can give you, the Mind Ray has put out across on top of the Konica Minolta, which is right now it runs anywhere from like 35 to $45,000. I'm not sure about the price of the G Venue, but I know it's also high, and Sonosite as well. So there's Sonosites there about $60,000. So the Mind Ray, it is a little lower than the Konica Minolta, but it gives you an amazing resolution for facial and for MSK. Um, the Clarios, I tried with the Clarios, and people are keep saying, "Oh, but the Clarios at 20 megahertz, and you have a 14 megahertz," and I keep telling people it has to do with the elements built within the transducer. That has to do with the spatial resolution, and that comes down to how well can you see, how of a image quality you can detect and be able to see everything that you're seeing. Just because you have a 20 megahertz doesn't mean that it scans better than the 14. But people, for some reason, they have that. I mean, now if you have a high caliber machine and the 20 and the 14, of course, you're gonna have that difference of image resolution because you're already starting scanning with a high end machine, and they're building those probes to be a big difference. Uh, what I find out with the Clarios and with the you know, it, it's it's good as far as if you want to do IVs. But as far as the solution goes, the machine gets hot, you lose connectivity. You have to charge it. Then you have to hold a tablet next to you. So it's a very and then you only have a one frequency. So if you want to, let's say, jump into do BBLs, or if you want to do something a little bit deeper, if you ever want to jump into joints and be able to visualize tendons and ligaments, then you're gonna have to buy another one. So, and I heard the price of the Clarios, they're running with from like 9 to 13,000, depends where you buy it. Butterfly, forget about it. Please don't use the Butterfly. The G Venue actually is pretty decent, uh, but the G Venue I think is a little more costly than the T5. So that's why I've tested them all, and I think the T5 stands out right now as far as right now the market goes. I haven't seen nothing yet, but if something else comes up in the market, why not? I'm gonna recommend it.
Hey, then you'll have to come by and train me on the new one because it actually made sense. So I did a training course with Stella prior, and she was fantastic. She had a really great course, and then with you, and it's interesting because after 2 courses, I still feel like I need a lot more time with ultrasound. Um, can can people actually do training with you, or is it through a purchase of a device? How does that work?
Yeah. So
How did you
learning.
come into my life? I don't remember.
So yeah, learning ultrasound it's a curving, it's a curving learning, and once you pass that curve, it becomes easier. But you really have to keep scanning to become comfortable with how to differentiate, the muscle from the fat and the anatomy. So I will start, obviously you guys know all the anatomy of the muscles. So start with certain muscles each time, and obviously how to if you keep scanning, your eyes will start to getting used to recognizing what's filler and what's not. I'm telling you, it will come. So don't get frustrated. As far as training, no. If you want to have a private training concierge, I will fly to wherever they want to get trained. They can call me or email me for pricing and details. Usually, the training will last about 6 hours total. We start straight. There's no breaks on it, unless if they want to take a little break. But usually, it's about 6 hours. Um, there are some people who do 8 hour training courses when you come into a conference. I try not to do 8 hours. I could do 8 hours, but I think 6 hours is enough.
I was spent after the 6 hours. I mean, we went
Yeah.
all the way through, including with chicken, using chicken breast to learn ultrasound guided, which is still in my fridge. It's disgusting, by the
Oh,
way, but it's still there. I really need to throw that chicken breast out, but it was a great way to learn. I don't think I could have done 8 hours. There's no way,
yeah. So
mentally.
yeah, it is. There's a lot of information, especially if if you start in the learning curve. But definitely, if you start doing right now ultrasounds, if you have a device and you need training, don't get frustrated. Again, I'll be happy to do a trainings for anybody who wants to get into facial ultrasound. I do provide 2 books. Uh, um, that so you have to kind of like look at it before the training so that you can get used to it, the terminology and a little bit of the anatomy, and then we'll go on it. I have injectors book, like with you, book a few patients during the day so that you get exposure. One with radius, one with HA, one if you want to do a threads, if you want to dissolve, then just a model to scan. So there's a lot of things that you can do in one day. And a lot of times, people have called me, hey, it was great. I'm getting better at it, but I need an additional, training again. That's not usually after 3 months that they've been practicing and playing with it. So they'll call me for a second part.
So I just wanted to say a little to give a shout out to our sponsor really quick. Just so everybody knows, today's episode was brought to us by Ayana Atelier in Old Town Alexandra, the aesthetic go-to place since 2021. They're now featuring wellness, including hydration, IVs, vitamin boosters, and medical weight loss. Visit their website at www.ayanatelier.com for more information, and you can interview their services and membership options. Now, to go a little bit back into this whole ultrasound, what are some interesting facts with ultrasound that you've had in cases? Because I know right now we're starting to see a lot for the occlusion stuff, but I'm sure you've had some instances or some examples where you saw ultrasound go wrong or go well. Give us some examples.
Well, to start off, like there were some experiences that I had with when I first started, and I did a training with somebody with a Clarius, and the machine kept just going, keeping shutting off. The first generation, you can change the batteries. The second one now you cannot, so you have to charge it on the little stand.
Mhm.
But, the Wi-Fi keep going on and off. That's with the devices. What I find out also on the ultrasound is that patient will come in and wants to get filler done, and then they ask the patient, and this is when I was actually doing a training. So we start asking the patient, we start scanning the patient's face, and then I look uh, silicone on their face, silicone gel. And it's really recognizable because you can actually see this snowstorm effect on the face. And I asked the patient, you have silicone, and they keep saying, nope, I never had it done anything on my face. And I keep hearing those stories that they will tell you that because they will forget. And I say, listen, there is definitely silicone on your face.
How do you
Are you
forget that you got silicone injected in your face?
Yeah. So then they start thinking about it and they're like, oh my God, yes, I did a long time ago, like 15, 20 years ago. I had a case also with a famous actress, a Spanish actress, that I went to scan, for example, their knees and her knees, and I couldn't see anything. And I told the same thing. I said, like, you have silicone, you have migrated all the way. And then she ended up basically telling me that, yeah, that she remembered now that she had silicone on her calf injected like 20 years ago. So yeah, and then that's one of those patients that a lot of injectors don't want to touch when you have
Yeah.
silicone because it's just basically a Pandora box. You know,
Oh, yeah.
you
You
don't
have no
want to start.
idea how anything's going to interact with anything. And if you get lumps and bumps, how you're going to respond to that and manage that complication.
Yeah, exactly. And then actually recently, I was with Jessica Minges. I don't know if you know her, Locks
Mhm.
Injectables. Yeah, and I went to do a training for her. And during the training, a patient came in and she said that she got some threads done 2 years ago on her nose. And actually, I just put a post that on my Instagram. And I happened to scan her nose and I saw that these threads were actually permanent. They're not actually, they don't go away. So they're permanent. And she had two on each side of the nose. Really cool case. So actually, I posted on the Instagram so you can actually see it.
I don't know. I mean, geez, permanent threads were, when were those even happening?
I know this happened in Europe. She got it done 2 years ago in Europe.
Oh, okay. I was gonna say, I
Yeah.
don't know of any permanent ones. Are
Yeah,
there
not
permanent
here. Yeah.
ones in the US? I don't
Yeah.
think so, right?
Yeah, in Europe.
Oh,
Yeah.
and
Yeah.
because typically they should be, I mean, if you're going to ultrasound your face for threads, those typically are reabsorbed around that 6 month
Yeah,
mark,
exactly. Yep. Yep.
right?
Yep.
Huh. What are some other things that ultrasound can help? So you can diagnose obviously the occlusions, but what other, let's say in the aesthetic space from a diagnostic side, what are some other things that you can use ultrasound to diagnose for our patients?
So, I mean, first you can map. So let's
Mhm,
say you are going to have a patient and you table and use, you wanted to, you mark the areas in which you're going to be injecting the filler, and you can just put the probe on top and assess for vascular.
mhm,
There's a big vessel, like let's say the temporal artery or the in the piriform. If you're doing, you want to make sure where the angular artery is. If it's is it close to the bone, if it's away from the bone, in the area that you're going to be injecting. Some really a few injectors they do inject live under filler. I think it's a bit, it's a little bit time consuming, but it's doable. Also,
mhm,
if you want to do a cannula, that's up to the injector. But also you can assess for again for if you're doing like for example like Kybella, if you're doing the platysmal fat, if you want to measure the platysmal fat, uh, and you can measure on the ultrasound, very very clear, and then you can have the patient come back like 3 months after and see the results, and it's nothing is everything is a fact. You scan the patient with the light pressure on the platysma area, you see the fat, and then you measure it 3 months later. Other things you can identify and make sure it's not, for example, patients will say, oh, I have a lump and I think I had a filler done, and when you go scanning, it's not a filler, it's a lymph node. So you can actually assess lymph nodes on the ultrasound, make sure you're not trying to dissolve a filler. That will be very, very painful to the patient. Um, and the rest, is just if you want to see the muscle, if you want, there's a certain muscle that you want to use Botox in,
mhm.
then you can actually identify the muscle and make sure, if you want to inject, either deep or the superficial masseter, or if you want to, you don't want to touch the DOA. So a lot of muscles that, whatever you want to identify, you can actually see on the ultrasound.
I'm excited to try the Kybella one just to kind of see what difference in the space after you go through Kybella. And I think it's kind of neat from a aesthetic practitioner standpoint because then you can actually have a measurable result that you can show your patients. Because sometimes, when you do something, we see ourselves every day, so we can't see that measured result. So I think that part's neat to be able to measure that.
Yeah, exactly, exactly. And also, too, you can assess, And again, one thing that I've seen a lot is every patient scans differently. You know, I have patients that you put the probe in their face, and my God, it's a beautiful anatomy. And then you go to the next patient, and you're having a hard time. You can see it, but it's just not clear. And all I have to say is, it's not you, it's the patient. And when I
You,
come
it's me.
when I come when I come to find out is that everybody has different composition of their body. So I have to do how the fat is, how much fluid you have on your skin at that time, on your subcutaneous tissue. So everything plays a role in how the sound travels down from the top to the bottom, and as it causes those interfaces, um, that you're gonna have change of sound, and that's gonna affect your image quality. Makeup too. So if you're gonna be scanning, try to have the patient take the makeup away. It's a lot easier. Anyways, if I inject it, you gotta take it out anyways. So that.
So, is there anything, so if somebody was interested in ultrasound, they're not doing it and they're not wanting to outlay that cost yet, because there is a cost associated with ultrasound. What kind of recommendations would you have where they can get some experience with it without having to do the full financial investment? If there are conferences that there's trainings at, or other ways that they can try different devices that
Yeah,
you know?
yeah. There's a lot of conferences actually coming up. There's one called actually I'm gonna be on what is it called? Aesthetics Next
Yep,
5.0.
that's next.
Yeah.
Mhm.
So I'm
That's
gonna be
coming
there.
up here in September in Dallas. Yeah.
Correct. Yep.
Mhm.
And so, yeah, there's a bunch of conferences that you can actually go in and get your feet wet on the ultrasound and play, and get exposure to it. Um, if you haven't buy a machine yet, I will strongly suggest, do not buy a machine without getting a demo, because everything looks good on paper. You can always Photoshop the images, you can always Photoshop videos that they send. So always do your research. Always get a live on demo, scan, compare machines. I know I do with Joel. We do what's it called, a Zoom live demo.
Mhm.
So during the Zoom, we put the actual machine inside the screen of the computer, so you can actually see live all the anatomy, so you can actually tell what can you not see. uh, if it's possible, obviously if it's local, then yes, I can go in personally and show the machine live, demo. But just to do a demo, for example, I'm in Florida, I'm gonna go to Kansas City,
Yeah.
just to do a demo. It will be a little bit far out. But yeah, so
Wish I
whatever
knew
machine you're
that
gonna.
because I didn't do that, and so I made the
Oh no.
mistake of buying a device and then having to buy a second device, so
Yeah, yeah. Always do your research. Don't just buy because you're seeing some pictures. Unfortunately, right now we live in the world of filters, and
Mhm.
you have to make sure that you're buying what you're expecting, or you're getting what you're expecting when you're buying the product. So always
Yeah.
do research. Yeah.
Awesome, thank you. Can you share with the audience what your contact information is if they'd like to reach out?
Oh yeah. Thank you. So my website is www.mskortho.com, which is M as in manual, S as in Sam, K as in kilo, ortho.com. Uh, my Instagram is musculoskeletal sonography. Those are my accounts, or you can always reach me directly. My phone number is 954-505-6406. If I don't answer, just leave me a text. Say, hey, I heard you in the podcast with Brandy, and just want to get information about it, so I can spend some time with you guys and let you know exactly the details of the course if you're interested.
Perfect. And then obviously anybody can reach out to me. I'm Brandy Gregg. My social media is the Blonde Clinician. So you can always reach out to me and I can give you Alfredo's information as well. I wish I knew some of this stuff before I got into it. I would have saved myself a lot of money. But I'm really enjoying getting into ultrasound. So I want to let everybody know that we're very grateful for you to listen. Hope you enjoyed this episode. Please share, follow us on the Aesthetics Injector Gang, and we'll talk soon. Thank you, Alfredo.
Thank you so much for having me, Brandy.
Bye.
Thanks for listening. If you enjoyed this episode, please like, share, and comment. Follow us on Instagram at The Aesthetics Injector Gang.